This morning, registered nurses at Saint Agnes Hospital in Southwest Baltimore are set to go on strike after contract negotiations hit a standstill.
Yeah, nurses say Ascension management has refused to address issues they believe are impacting patient care. WMAR2 News' Kara Burnett's live outside the hospital for us. So, Kara, they've been at the bargaining table now for well over a year. What are some of the concerns that they've been bringing to management?
Yeah, that's right, Megan and Randall. I mean, we're talking about 18 months of contract negotiations. They're fighting for increased staffing. They said that there's high turnover rates as well as a lot of floating. So they'll move different RNs from their own units to different departments to try to fill those staffing gaps. Now, we know that at 7 a.m., that's when the striking will start, with the rally at 9 a.m. And we already see some RNs out here in front of the hospital starting to set up for this rally. And really, again, fighting for these things that they said that they want in their contract because they have been bargaining for over 18 months now. Now, this marks the first time hospital nurses in Baltimore have gone on strike. Back in May, the nurses authorized a one-day walkout following 18 months of stalled contract negotiations. The union, National Nurses United, represents more than 600 nurses at St. Agnes. So here's what they're looking for in their contract: safe staffing. Nurses want more authority to request extra staff on floors where there's a heavy patient load. Then there's floating protections. They say RNs are being moved from their own units to different departments to fill gaps in staffing. I spoke with two RNs who've worked with the hospital for about a decade, and they say that the staff is stretched thin, which really, takes a toll on patients, they say, and they're hoping that this will help move the needle. They add that there has been movement on some aspects, that the hospital has offered a 3-year contract instead of a 1-year, but that enough hasn't been made with the progress. Now, as far as the hospital, they say that they are fully prepared to remain open and continue providing care during the one-day strike. A statement from the hospital reads, in part, this decision not only undermines the progress of negotiations between St. Agnes and NNU, but also creates unnecessary hardship for our associates and their family, as well as concern for our patients and their loved ones. Now, just coming back out on camera with this, again, we see a lot of these RNs just starting to set up for this strike, which will begin at 7 o'clock this morning, and then a rally scheduled and lined up for 9 o'clock. Now, I do have more on this story. We'll be out here for the rest of the morning, just hoping to speak with some of the staff here, just hear their concerns, and we'll have a full breakdown on our website. Reporting live, Kara Burnett, WMAR2 News.